Good afternoon and welcome to Tracy's Keeping It Real. What an exciting afternoon. I got my favorite people in the room this afternoon, and we're here. It's a cold day, but we're in a warm room and we're really celebrating Women's History Month. And so we're really excited about some of the news that we're going to be talking about today because one of the things that we know that's very important is our health. And even if it's cold or if it's hot, it doesn't matter. We just want to make sure, whatever the case is, that we're taking care of ourselves. And so we're going to learn more how women, and I'm sure some of the men will get some use out of this conversation as well. We'll learn how to be better with women's health. So to this afternoon, I got Dr. Rahshana Price-Isuk here to talk more about what's going on at North Point and some of the programming that's going on over there. And so, welcome to the show this afternoon. Tracy's Keeping It Real.
Thank you, Tracy. I'm happy to be here today.
Oh, it's so lovely to have you. And how long have you been over at North Point? I haven't had the opportunity to meet with you before.
Yeah, so I've been at North Point now for 5 years as their director of clinical services, and I'm a family physician, and I've been in the community for 20 years practicing medicine.
Wow. So, what does Director of Clinical Services mean? Is that like you are a doctor, or are you, explain to our listeners and our viewers what that means?
That's a great question. So, I am a family physician and I see patients part time at North Point, but I also serve on the executive leadership team as the director of clinical services. So, my area is integration of all of our four departments, which includes human services, medical, dental, behavioral health. I'm also over compliance, so keeping us compliant with our federal, state, and local regulations, and also quality improvement.
Wow. So, you're just kind of holding it all down over there.
Helping, yep. Teamwork makes the dream work.
Yes, it
Yes.
does. Great. So you can you actually do see patients, as you said, and that's just part of what your job is, and the other part is kind of overseeing a lot of that other
Right,
very important.
administrative work,
Yeah,
yes. Yep.
absolutely. So I know one of the, we're right now we're in the midst of really kind of celebrating the Women's History Month, and as I open the show up this afternoon to talk about, the importance in women's health, but also I do know that North Point does a lot of different things over there. And so what are some of the other things that, because I also indicated that men also will find some benefit in this. So what are some of the other services that the community taps into as well?
Yes, thank you for asking that important question. Because as you mentioned, we're going to be talking about women's heart health, but North Point has been in the community for 55 plus years. Serving the community with healthcare and human services. So we have support for food insecurity. So we have an on-site food pantry. We can offer support for housing, employment help. We have a full-service dental department, behavioral health, so we can take care of our, mental health. And also medical services. We have pharmacy, radiology, mammograms, and plenty of doctors and nurse practitioners to provide health care.
Wow. Now, do you have to? I know North Point is in North Minneapolis, but do you have to live in North Minneapolis to access some services?
You do not have to live in North Minneapolis. Obviously, we're a staple in the community and we serve our North Side community. We also do not turn anyone away for ability to pay. We take insurance, we take those who do not have insurance, and we take those who have high deductibles. We can offer discounts to folks. We can help people get seen and get what they need.
Wow. So that's a full service medical center over there, pretty much for the most
Full
part.
service,
My goodness.
absolutely.
So, tell me, I know a lot of people may wonder, like the when for housing. So, how does a health center help with housing?
Well, we're a connector. So,
Okay.
like you said, we're full service. We're a hub for the North Side. We have certain criteria, grants, and resources that we help provide for folks who might need assistance.
Nice, nice. I know, and then you've grown over there. I know at one point I know that North Point was just located right there in Plymouth and Penn, right behind what most people might know of is the funeral home, the
Yes,
Estes Funeral Home.
yes, yep.
But now you got that campus, and then you got across the street 1256 building, and then there's a bunch of places even on Broadway you're located. So there's a lot of different North Point campuses now.
Absolutely.
Eh,
North Point has expanded. We have just opened our new expansion last year, which has been like a 10 plus year project. Then we had our grand opening. So all of our services are now on one location, but we also have satellite services. So we're located on West Broadway. We have our Heritage Senior
Oh,
clinic that sees ages 40 plus. So we're doing a lot in the community, and we're here to serve.
nice. My goodness, I and now the even that heritage one, do you have to live in that building to access that one?
You do not. It's separate from the housing
Okay.
facility there.
Great, because I'm familiar with that one. We've had events over in that area,
Yes,
so I didn't know. It's just good to know when you can visit and get health care at all these different locations. You don't have to be from that area in order to access it.
correct.
And I got one other question as far as just the services go. I know that it seems that at one time there was quite a few people of color that worked there as well. Is that still the case?
That is still the case. We hire from the communities that we serve. So we have staff of color. We have staff that speak multiple languages. So that's how our staff is made up.
Nice. So when people come there, whether they're an African American or Latino, or if they're from the African community, you got representatives of these different communities, and people can come there and be able to speak to people and be able to be understood on top of just speaking to them.
Yes,
So that's
yes.
wonderful, because that's another problem when we, with our melting pot of people in our communities, we get people coming in that don't speak the same language, or you don't understand what they're saying. So it's important that people know that at North Point they can go there and get that kind of help.
Absolutely. North Point prides itself on providing culturally responsive care in all that we do.
Nice. And again, wanting to know where their black doctors at. I'm always asking that question. I'm like, okay, you want to know where the black doctors are? Go to North Point, you'll
Go to
find them.
North Point.
All right.
Absolutely.
All right. Well, one of the things we started off talking about was just about the women's health, and talking about as we're celebrating Women's History Month. And so North Point started this new Women's Healthy program. Can we talk about that and what that's all about?
Yes. So this is our Women's Heart Healthy Social Group, is what we have coined it. This initiative really started with one of our Hennepin County commissioners who put dollars in public health to support African American and Indigenous women knowing more about their heart and their heart health. And what happened to her is she had a heart attack as an African American woman at age 45. When she reached out to North Point about doing something, I met with our medical director, Dr. Kevin Gilliam, and a team of us, and we were trying to figure out how can we promote heart health in our community for African American women and Indigenous women specifically. And what we came up with was we wanted to use the circle of safety and not necessarily the medical model. So we created a support group where African American women can learn. So we have different specialists that come in and talk about the heart, but they also get to share their own personal stories about things that they have been through. So this is for women who have high blood pressure, or they've suffered a heart event or a heart attack. And we talk about their journey and their story.
Wow. And so with the commissioner, she had a heart attack, you said.
Correct.
And so knowing and being so young, I think a lot of times we don't look at our health as we're too young to have a heart attack is what we think. Not realizing that we can be younger and have one. So what is kind of a few of the causes that that people overlook?
Yeah, I want to answer your question, but you hit also on something about the commissioner being young and being African American and being a woman. And a lot of what we address in this group are the atypical symptoms of a heart attack that can happen in women. We also focus on stress management because the commissioner, like so many other African American women, was having atypical symptoms, but also did not stop what she was doing because she has children and a job and family and kind of kept going in spite of not feeling well. And so many of our women do that. And so we're really in this group teaching about what are the symptoms, how can we manage stress, and then how can we prevent? What can we do to put ourselves first so that we are there for our children, our sisters, our mothers, and all the people that we're taking care of in our families?
Yeah, and strokes and heart attacks and all that are, you hate to look at it, but they could result in death. If not, death, then you could end up handicapped as a result of it, or so many other things come bad from it. I had a friend that had one, and now it's her memory is not as good as it used to be, and just her thinking is slow, and it's just we gotta slow. And I would have never thought looking at her that that was even a thought that she was being
Sure.
stressed out. So I think, when we understand some of the signs that we're dealing with, I mean, I sometimes joke about y'all gonna give me a heart attack around here. But in
Right.
reality, it might not be a joke if you're burning the candle on both ends, you're trying to make it work, and you gotta slow down and catch your breath sometime. And I think
Mhm.
that doing this whole initiative around healthy heart social group is so important for us as women, specifically African American women. We have a place where we can learn what this is doing to us and how we can our lifestyle is doing it to us, because we're the whole provider. We take care of our husbands or whoever
Yeah.
males might be in our lives. We take care of. I was taking care of my mother. I was running a company. I was trying to be a grandmother. Trying to be was one and very good
Right.
one.
Absolutely.
and, and,
Yes.
and doing all the things that I do. But sometimes it's like, okay, at what point did I look at taking care of Tracy? You
Absolutely.
know,
Yeah.
that was never on my radar. It was always
Correct.
making sure everybody else was good.
Absolutely.
And so we got to learn how to slow down, and we got to know what some of the signs are. So what are some of the signs?
Yeah, so some of the we'll talk about the non-traditional or atypical signs, especially for women, can even be so abdominal or stomach pain, like a deep ache or pain that's new or different. It can be pain in the back between the shoulder blades. It can be severe fatigue.
Mm.
So when we talk about, a lot of us are tired, chronically fatigued, but when I say fatigue, I mean like yesterday I could walk 3 stairs and be fine, but today I can walk those same 3 stairs and I'm worn out. It could be profuse sweating, different than like if you're having hot flashes, this might be different. Or if you've never had a hot flash and you're sweating, that could be the sign that your heart is being overworked, or that your heart is being stressed, or that your heart is not getting the oxygen that it needs. So those are just some of the non-traditional signs that
And
we can have.
and a lot of us have all of them. Not necessarily that we identify with them being not normal. We just associate them with being normal.
Correct. Absolutely. So if you've had something for 2 years, so you say, "Oh, I've just had this ongoing tiredness, but tomorrow it's totally different, like it's a deeper level." If there's any change in your health status, that's when you should be alerted that something could be wrong. And I always say it's never wrong to go see your doctor. It's never wrong to call your clinic, call your provider, get seen, get checked. At least you can know, is there something going on or is there not something going on?
And I think if they can just call and ask a question, that it can't be any easier than that. But what happens if they're not accustomed? I mean, I think most women are, but there probably are some that aren't accustomed to going, and they may not have a regular physician that they see. Is there like a hotline that they can call over there and talk to somebody, or
Well,
ask questions, or they need to come in at that point?
Well, we usually recommend people get seen, but we have one main number, and we're going to talk about that, but it's 612-543-2500. You can be connected with same-day appointments at North Point. We have urgent care appointments. We also have nurses that triage medical symptom calls, so they can tell you, yep, come on down, or no, you really need to call 911 because it sounds more urgent or something that we can't handle, in the clinic.
Nice. And so there's urgent care there even.
We do have
Wow.
a urgent
My
care. Yes.
goodness. I didn't even realize that we had that service over there.
We
That's wonderful.
do. Just know urgent care isn't the same as the emergency
No, it's
room, so it still
certainly not.
limited,
Yeah.
but those same day urgent appointments where you might need a chest x-ray because you think you have a pneumonia, or you might need an EKG to evaluate this chest pain, we can do a lot at North Point.
Yeah. And again, to your point about urgent care not being emergency, we don't even want people to use urgent care if they can just get regular care and avoid both
Absolutely.
urgent and ER. Yeah,
Absolutely,
yeah.
because prevention is best.
It's the best way to go about it, and it can really take that stress off of you,
Yeah,
that you're not worried that you're having a heart attack if you're
correct.
doing things right in the first place. Now, I know we talk about the healthy heart. Is the healthy heart also associated with the stroke and then heart disease diagnostics? What does that look like? Different than a heart attack?
Sure. So, heart disease can be actually as simple as high blood pressure.
Mm,
Okay, high blood pressure leads to heart disease. A lot of people talk about congestive heart failure. Well, congestive heart failure, we're taught, us medical types are taught, it's a symptom. So if someone has congestive heart failure, we need to get at the root of what caused it. Was it high blood pressure? Did you have a heart attack and not know you had a heart attack? Do you have an autoimmune condition like lupus and other things can cause heart disease and heart failure? So it's very complex, to be completely honest. But you did ask about the causes earlier, and some of the causes of heart disease are the same causes of things that can lead to a stroke.
mm.
So, high cholesterol, diabetes, because diabetes can cause inflammation in the blood vessels that leads to stroke and heart problems. Cigarette smoking, because it hardens the arteries. So things like that. Just lack of exercise and being completely sedentary. All those things can lead to heart disease and stroke.
Now, when you mentioned exercise? Can we walk a little bit and that helps it, or is that not enough?
Oh, that's good. Anything that you can do that's an increase from what you're already doing is going to help. So even if, folks who might be limited mobility, so that you're in a scooter or you're in a wheelchair, if you can do something with your arms or do something with your legs, that is activity. So the little by little that you can increase your activity, it's going to help.
Nice. And I know one of the things I've even seen exercises when you're laying down, just
Yep,
lifting your leg if you're able to, or like you said,
absolutely.
back to lifting your arms, or
Yes.
just something like you say to move your body parts around. So how do women there connect? Because I know that this whole thing is around social groups. So the social piece to that, how does that happen? What takes place when I do this event, is you may or may not know about Sister Spokesman, and that's a social group.
Mm.
And my goal is to make it social beyond that day. So is there a social connection that women are making beyond that day to help each other out?
So that's part of how we would like to expand our program next level. So right now the program is in cohorts. We accept about 10 total, okay, and the cohort is for 6 weeks.
Oh, okay.
Yeah, during that, each week the women receive a meal and they get to share and they get a topic discussion from one of our North Point specialists.
Oh,
So we have a Black female dentist that comes in to talk about how gum disease actually affects your heart. We have a health coach who talks about stress and healthcare advocacy. Myself and Dr. Gilliam come and talk about the heart disease element. So each week there's a different topic. at the end of the cohort, the women are so connected
Mm.
that they want to continue to be together. So we are now offering them other services, like our exercise classes and other things that we're starting to offer at North Point, so they can kind of move along their journey together, because they are asking to stay together and stay connected.
Mm-hmm. And then with the different cohorts that you'll be building on, that will
Exactly.
help them to be able to do that.
Yes.
Nice, nice,
Yes.
very nice. And so we got to get some of them, that first group, because this is new.
So this is into our second year.
Our second year, okay.
Yep. So our 2025, we did 3 cohorts. This year we'll have 4 total. And so at the end of last year, we'll do it again this year. We brought all the cohorts together and we had a winter celebration and had food, and we had massage and other things for the ladies that they could partake in. And then we had some presentations about the success of our program. So we'll do that again this year, and we're continuing to build.
Nice, nice. And that's got to be because sometimes when we're not living right and we feel like we're overstressed and we're not eating right, we need somebody that maybe is going through the same thing. It's like, I get it. I get it. This is how we slow down. This is how we take care of ourselves.
Yep.
And if you got a sister girl that's sitting there with you and it's like,
Yes.
hey, I'm doing this, this, and this, and this, and they might even be doing more than you. But yet and still they're showing you how they're taking care of themselves and how they're slowing it down. It's gonna help you to think, oh, okay, I guess I could slow down.
Mhm.
Oh, okay, I can do that little bit, and that's going to make a difference in my life. But I mentioned earlier something about walking and just doing a little bit of walking. You said that was at least something to get you started. It was good because you were at least doing something more than you had been. But don't you got something about walk and talk with the doc that people maybe
Oh,
could come and find out about?
Thank you for reminding me about that. Yes, we have a program called Walk and Talk with the Doc. Myself, you can walk with me or you can walk with Dr. Gilliam. We switch off, but it's a program held monthly, and one of our community health workers coordinates it for our seniors in the community. We meet at North Point and we walk up to the trailhead, and for those who can only walk one way, we can provide a ride. So we walk and then we sit down, we have a snack, we have some water, and we talk about the questions that people have for the doctor. So
Oh,
yeah,
nice.
so it's awesome. It's very successful. We'll be starting it up again as the weather gets better.
And now, where is the trailhead from the clinic?
So it's about 1.5 miles. It's at Theodore Worth
Oh,
Parkway at the.
you literally are walking at
We're
that
literally,
point.
yes, we're literally walking,
Yeah.
which is why we do have a van follow us in case someone,
Mm.
can't finish the entire walk. So, but it's so
Oh,
fun.
nice. I'm gonna have to
Thank
come and
you.
join you on that one.
Absolutely, please do.
I
We'd
love
love to
to
have
walk.
you.
Yeah.
Yes, I do too.
I no, it's so refreshing. I actually have a treadmill that I never get on because it's not the same as being outside.
It's not.
Yeah.
Absolutely.
But so how about some of the other services I know that you guys offer over there for diabetes or diabetics rather, and other services like that?
Yeah, thank you for asking. So we recently started our diabetes group visits. We also have high blood pressure group visits. Now, those are different from the women's heart healthy social group because they are a medical model. So you do need to have an appointment with a North Point provider,
Okay.
and then you can get referred into one of those programs if you have diabetes or high blood pressure.
Okay, but you still offer a
We still
program?
offer a program.
Yeah. And that's so important. And then they can get it all done there. So if they're coming there and they get referred by a doctor there, then is that referred to the specialist then right there?
So the way this would work is we would like for the person to establish care at North Point, meaning become a primary of North Point. So have your primary care provider there. So if I were your primary, Miss Tracy, and we're in the office and I'm saying, Miss Tracy, I'm going to change your blood pressure medication. I need you to stop eating so much salt. And I'm going to refer you to our high blood pressure
I'm pretty
class.
sure I'll find
Yes.
another doctor.
No, you won't.
Did they give the secret up?
That's funny. So then I would refer into that class and you would take that class or that group model for 4 weeks, and then you just come back and see me later.
Nice. So I'm referred right there though. I don't have to be referred
Correct.
somewhere
Oh
else.
no,
Because usually
no ma'am.
people think about referrals, it takes you away from where you're at.
Correct. No,
Yep.
this is all in-house.
Nice. Very nice.
Yes.
Well, the assault thing, we won't talk about that.
Okay, not today.
Not
You can have me back. We can talk all about it.
Yeah, we probably need to because that comes from the high blood pressure. That helps. That
Well,
helps to keep it high.
and our people are very sensitive to salt or what's called sodium. And in our women's heart healthy social group, one of our specialists is our dietitian,
Mm.
who's also an African American female who takes them to our teaching kitchen. NorthPoint has a teaching kitchen.
I know it. I heard about it.
Yes, and we cook and we show them how to make food delicious without too much sodium or salt.
Wow. And how long is that? How long do they do that part?
So for the Heart Healthy Social Group, one session is on nutrition and they do that. But we have other ways to have people come in and also do classes in the teaching kitchen. Right now, our program is centered on congestive heart failure, and pregnant and postpartum can get classes for the teaching kitchen.
Wow. Yeah, because I probably need to come to there too. 'Cause I
Yep.
like to cook, but I am one that likes to use salt in my food. So, and
Me
trying
too.
to learn how to use other healthy seasonings is
Correct.
something I need to learn
Yeah.
better.
Well, you need a little salt. It's more about the hidden salts and then putting salt on top of that. So we teach all about the Maggie cube, which is big in the African culture, which has a lot of sodium. It's like the bouillon cube here in America. So we teach about how to knowing what you're actually eating and how
Okay.
that
And what
impacts.
kind of so just what's on the beaten path, but not exactly. But what about pink salt? Is that good for you?
Salt is salt.
Oh, salt is okay.
That was the easy one. Yeah. No, we don't need to digress.
I do have pink salt, but sometimes people make you think, well, pink salt's good for you, so I guess salt is salt. So that's not necessarily the case. So, gotcha. So I know we got the group conversations that focus on honoring our heart health, caring for blood pressure. So, what do they learn about that? Caring for blood pressure. They
Learn about the sodium, learn about taking medications, learn about exercise, learn about all the things
And
we
that's that
talked about.
moving with joy is the exercise part of it. And then
Correct.
managing stress. Ooh, now that's one that's probably got to be a longer session, I would almost think, because we're talking about managing stress and embracing rest. I have the hardest time embracing rest. How do you convince people? Or how do you do that? I mean, when you're go go go, ever ready bunny. I only sit down to watch TV, and that's at the end of my day. And by then, I fall asleep in the chair. So, how do I embrace rest so I get it so I don't do that? Because I hope that's not a sign that you were telling me about earlier.
Sure.
I think I'm just wearing myself out at that point. But see, that's how you talk yourself into what you think you're self-diagnosing yourself with.
Correct. Yeah, don't self-diagnose. Yeah, so our health coach comes in and she teaches breathing techniques and meditative techniques that help bring down heart rate, bring down blood pressure when you're stressed. To your point earlier about the women, they teach each other. So we teach the techniques and they start getting on each other. They'll come in next time and be like, "Did you rest this week? Did you drink your water?" And they listen to each other. So it's really like we take a step back after we give the tools,
Yes.
and that's the beauty of the group.
And that's that whole piece when I talk about the social piece.
Yes.
Because they start to get socially involved with each other and they teach each other, or they kind of are their conscience in a sense.
Yes.
And kind of without being the doctor and getting on them. It's just like, girl, did you do this?
Yep. They
Did you
hold
walk
each other
today?
accountable.
Yeah, that
Yes.
accountability.
Yes.
And we need accountability
We
as
do.
people, as humans, because if we're doing it wrong, we're not just going to automatically always do it right. So
Absolutely.
accountability helps you to just stay on track. And I like accountability because I try to be my own accountability person, but it's easier to just do things without having to explain it to myself.
Right. Absolutely.
Yeah. So yeah, but so we talk about prioritizing our health and advocacy. So do we have some of that advocacy, or is it with North Point? Or is that more of
Well,
uh, go ahead.
yeah, we have a whole session on self advocacy in healthcare. So, this is where we help the women how to navigate a doctor's visit, appointment, how to ask questions, bringing someone with them. Because the truth of the matter is, they're not always going to have a healthcare provider that looks like them.
All right.
So, we need to help them kind of be their own best advocate. So, that's what that whole session is about. So, we spend the hour talking about that.
Okay, and then with you being right there amongst the ladies and then going and doing your second part of the job, which is kind of overseeing a lot of the processes and making sure that that advocacy piece is still in there as well as part of your other part of the job. That's very helpful because you're actually seeing it firsthand.
Absolutely.
And so you're not talking about something just out of a textbook. You are experiencing it, you're having conversations. What could be better? I mean, so when people come to North Point, they're really getting some really firsthand help. And I think it's a
Absolutely.
wonderful thing. I
Thank you.
I just wish you had one in South Minneapolis. So
We're not that far. Come on down, Tracey.
I,
We're not that far.
I know I come over to North Point all the time. So I will be coming over there and joining you guys with that walk for sure.
Thank you.
So is there some takeaway points that we need to talk about to reinforce getting ladies in there, getting men in there? Men need to get in there to do things for their health because hey, we all have hearts, so and we all have the same problem. This is just a women's focus group, but we all could have a heart attack. Men, women, we all could have strokes. We all could be doing things better. So, what are some of the takeaways that North Point offers, and what makes North Point better or different than maybe someplace else somebody else is going?
Yeah, I just think North Point is special because we provide whole person integrated care, community based care. We let the community tell us what's important, and then that's how we move. Everyone should call and just make an appointment. Prevention is best. So when you're feeling good, that's actually the best time to come to the doctor to find out what do you need? What screening should you have? The choice is always up to the guest, the patient, the community member, but you do yourself a service by getting the information and the tools that you need to make the best decision for yourself. That's what I would say.
And making I always say if you have the option to be told what to do versus doing it on your own, most people like doing things on their own.
Absolutely.
But if it's not preventative, then now you go to this being told what to do because then it's up to the doctor trying to save your life. So now they're telling you you need to do this, you got to do that. We want to get people away from that because if you wait until that's your bottom line, it's like, oh, I can't eat this and I can't do that. Well, then that's no fun. So if we can get more into preventative, we can do all these things. We just have to learn how to do them in moderation, including myself. So I get that part.
Sounds good. You
I'm
got
just
it.
preaching it. I got to actually do it because I do um, have a desire to live long enough to see my grandkids grow older and then have their families and also just to be here because I enjoy life and
Yeah.
I like living a healthy life. I don't want to live one where I'm on medications that are real heavy. And I think all of us can prevent that by just doing things the right way. So, what about insurance? We talked about no insurance or low insurance or deductibles earlier. What talk about that for a minute, if you would.
Yeah, well, North Point doesn't turn anyone away. We can put people on discounts based on their income if they can't afford, their high deductibles, or if they have no insurance at all. There's a not, there might be like a nominal fee to get you in the door, and then the rest you can be put on a discount to help pay.
Nice, nice. And now there's a Minnesota. Is that still an option anymore? Minnesota Care. I mean, if so,
Yeah.
people can get on that still.
So yes, we also have what's called Mentor Navigators. So we have folks in house that can also walk people through their eligibility or help them complete applications and things like that.
That's
So
you know where I was going with that question.
I did, I did. You got me.
Yeah, I was like, okay, because that was gonna be next. So you already got me on that one. So, and we talked about it being culturally responsive, which is also a wonderful thing. But and then we just talk a little bit again about the whole person care all in one place and each one of them components again.
Yeah, our model, we try to implement like taking care of the whole person. So, again, the mental health, the medical, the dental, the human services. So, if people need resources to connect them, because we know the social determinants of health, right, are important, like
Hmm.
being able to have employment, water, transportation, food is important for your health. So,
Very.
we take that approach that we treat all of you.
Nice. Well, if they don't get it there, then there's nothing they're gonna get because they're getting everything right there.
Right.
And so, what's the call to action? What is the things that we need to make sure that they know how they can reach you or how they can reach North Point? And then, if they want to know more, some people actually want to do research before they do anything. Is there a website they can go to? Is there other things that they can do to help them get to that next step?
Sure, they can. I'll recite our number again, which is 612-543-2500. We do have a website, northpointhealth.org.
Nice. Okay. Well, so they got it. They got the phone number. They got the website. We'll also have that listed at the bottom of the screen so they can see it again. But just hearing that there is a way to either call or go online to make that connection, because we know that North Point is the place that we want people to go to know that they belong there. And whether you need support for your health, heart, you trust it. It's a trusted place to get care, and a team is there to help us when we need help in all the different areas. And the team, if they're just as friendly and as nice as you, it's a welcoming place to be.
Thank you.
So let's just make sure that we check out North Point. Let's make sure that we don't miss that opportunity to get seen before we need to get seen. And thank you so much, Dr. Rahshana, for all of your wonderful wisdom. I look forward to having you back.
Thank you.
We'll talk some more about some of the salt that I won't be taking after a while and my health. And just so people can say, okay, if Tracey can do it, I can do it.
There you go.
So thank you so much for joining us this afternoon. And remember, Tracey is always keeping it real. Until next time, look for us on social media or check us out on our website at spokesman-recorder.com. Take care.